As a woman in your reproductive years, before thinking of becoming pregnant, there are many visits you need to make to a health facility. One of them, which unfortunately many think less of or never at all, involves taking a diabetes test for diabetes type 2. This type of diabetes stressed to increases in overweight, obesity and physical inactivity. Just an instant needle prick and within seconds you know your status.
3.5 to 7. So you are within the normal range. You are fine, you have no diabetes.
And with that declaration of being diabetes-free, you can start the process of conception. However, not many women go for such a test, and they will instead get the shock of discovering they are diabetic months later into their pregnancy.
Gestational diabetes is that diabetes that comes for the first time when somebody is pregnant.
Some of the symptoms, though not so evident as in type 2 diabetes, include blurred vision, fatigue, increased thirst and urination, nausea and vomiting, frequent infections to the bladder, vagina and skin, as well as weight loss, despite an increased appetite. Though Uganda's statistics on gestational diabetes are not clear, in the US, according to the National Diabetes Information Clearinghouse, out of every 100 pregnant women, between 3 to 8 get gestational diabetes. Worldwide, according to the International Diabetes Federation, it develops in 1 of every 25 pregnancies. Though the real cause of gestational diabetes is not known, there are so many things that happen.
A mother who had a history of having delivered big children earlier, like above 5 kilograms, in our society we might think this is a big, beautiful, nice baby, but that is not an acceptable weight. So we put that mother to be at risk. Also, there are hormones that pregnant mothers have, and when it is overproduced, it interferes with the normal activities of the body, so that person can get diabetes.
Other risk factors include having a history of diabetes in the family, if you're above 25 years of age, overweight or have glucose in your urine. But when it develops, the best way to prevent its adverse effects is to catch it in its early stages by beginning prenatal care early with regular visits, having prenatal screening at 24 to 28 weeks into the pregnancy.
But once you don't take your medication well, don't go to see your doctors, then they may deliver this very big baby. You are not able to deliver normally, you end up being scissored, maybe even you can have a miscarriage, maybe you can have a stillbirth.
The C-section may increase the risks of infection and prolong recovery time, and at worst, the baby may die during the last 4 to 8 weeks of pregnancy. Insulin is the best treatment for a diabetic pregnant woman because it is not transferred to the baby's bloodstream, but your sugar levels must fall within the acceptable range.
70 to 110, that is milligrams per deciliter.
Pregnant women are advised to have a diet low in fat and calories and plan their meals accordingly. You may have to limit sweets, eat 3 small meals and 1 to 3 snacks every day. Be careful with carbohydrate-rich foods. Make fiber part of the meals in the form of fruits, vegetables and whole grain crackers, cereals and bread. Though after birth, babies risk having low blood sugars during their first few days of life and poor breathing, upon checkup they are always free of diabetes, but not that safe.
They are at a potential risk in future.
And so is the mother, who may after 5 to 10 years develop diabetes type 2 or even get gestational diabetes upon having another pregnancy. In obese women, the risk is increased. So, between 6 to 12 weeks after the baby is born, the new mother is advised to go for follow-up testing of her sugar levels. After birth, your gestational diabetes disappears, and according to the US's National Diabetes Information Clearinghouse, breastfeeding is okay and can lower the chances of the child getting type 2 diabetes. However, you must maintain the child's healthy weight. And as a mother, you should exercise to prevent or delay development of type 2 diabetes. At least dedicate 30 minutes on most days to either walk, swim or dance. Reduce or quit smoking and watch your alcohol intake. Generally, a change in your lifestyle will save you. Florence Nalimba, NTV.